Maintenance of cervical collar and changing of pads. Use spinal precautions and the log roll technique throughout the entire procedure. Open the hook and loop fastener on one side of the collar and lift the front portion of the collar while the assistant applies cervical spine immobilization. Assess the skin for redness, irritation, breakdown, or debris under the collar, especially over bony prominences such as the chin, clavicles. Perform skin care. Do not apply powder or lotion to the skin under the collar. Assess whether the pads are clean and dry. The pads are meant to wick moisture away from the skin. If the pads are soiled or damp, attach replacement pads by folding them in half with the dull side facing out and centered in the white shell. Adjust the pads as needed to ensure that no plastic is touching the skin, and reapply the front piece of the collar. While the assistant maintains spinal precautions, log roll the child to one side and place a towel or small pillow under the child's cheek. Use assistance to log roll the child if indicated. While the assistant maintains spinal precautions, open the hook and loop fastener on the side of the collar and lift the back portion of the collar. Inspect skin, perform skin care, and change pads if necessary. Reposition the child supine with the log roll technique, or position the child as desired, ensuring that appropriate support and correct alignment of the C-spine is maintained. Ensure that the child cannot slip his or her chin inside the collar. If this occurs, the collar is not snug enough. Families are given instructions on how to clean the pads on discharge. Harsh detergents and bleach are not recommended because these agents can damage the pads. Cervical collars are part of our national DME documentation criteria. So we would document in the child's chart when skincare is done and complete one of our DME forms.